I'm Cindy Chen, and this summer I'm working with Chris, Ike, and Carl on this project with a nonprofit organization called Health Please. So Health Please is an organization. They set up a lot of desks in hospitals in low-income neighborhoods. They're trying to. They also train a lot of college students working on those desks, and their purpose is to help the patients to address their non-medical needs. For example, if a patient going to a hospital, they have asthma, but the asthma is caused by they're living in a moldy house. So simply taking medicine will not solve their problem from the root. So these college students trained as advocates are trying to help them find better housing and also better education and also some other needs including food, utility, transportation, childcare. So this is Health Please's purpose. However, unfortunately, they are facing a huge issue that they have about 40% of the clients disconnect in the middle. Like disconnect means the advocates call the clients every 7 to 10 days. If they call them 3 times and they don't pick up the phone and they never return text and they just disappear, then they will mark this client as disconnect. This is something Health Please does not want to say because they still want to return this client and help them solve their issues. So our goal in this project is we're building predictive models to predict which client is going to disconnect or is highly likely to disconnect. So Health Please can help to return them. So these are we built these predictive models, and these are some of the variables that turns out to be very predictive of whether a patient is going to disconnect. So the first one is need complexity. That is, this client might have a lot of complicated needs, including housing need, education need, child-related needs. So if more complicated their need is, they're more likely to disconnect, simply say. The second one is responsiveness. Responsiveness is whether the client is responsive to phone calls and responsive to other contact methods. The third one is initial interaction. This captures the interaction between the advocates and the client. If they have positive interaction with the advocates, or they feel the advocates respect them, or they have like very good experience and they feel the advocates' background match their background, they tend to be more engaged. There are also some other factors, demographics, background, and the location of the clients. These are all factors we take in consider put into our predictive model to use that to predict whether the client will disconnect or not. So I'm just giving a simple high-level illustration here. This is example of assume 2 clients came on day 1, and the green person and the red person, and they have very different need, and they have background. They also have different experience with advocates, and maybe one of them also have a lot of children. So we just take all this information about each of the clients. Then over the course of the first month, we will get more information about their behaviors, whether they pick up phone calls, whether they are responsive to what they're asked to do. Maybe they go to a resource they're referred to get. And so we get more and more information on each of the clients over the course of the first month. Then by day 30, our model actually can perform very well to predict whether a client is going to disconnect or not. So for the client that is going to highly likely to disconnect, this knowledge is very useful for Health Please. They can take this knowledge and to provide more intervention to try harder to return this patient. So this is the impact of our project. Yeah, this is all my presentation. I'm happy to answer any questions.
How good is your prediction? I'm sorry, this is not clear. How good is your prediction at day one?
So on day one, we don't have any of the
Right.
responsiveness. Like we don't know whether they will go in, they behave.
I understand.
Like,
So
we can only, yeah.
So maybe like the thing is that if you call twice and they didn't pick up, then it may not be too hard to predict that they're not gonna pick up a third time.
Yeah.
So before you see any of that, how good are you at predicting what's gonna happen in 30 days?
So currently our model actually not performing very well on day one. I know that's the ideal situation because our data currently have very low coverage on their background and we only have about 20 to 30% coverage on their the language they speak, their previous history, and their gender, race, ethnicity. Those are very low coverage. So as also one of the outcomes of our project is we will suggest the health leads to have better practice of collecting data on when they do the intake of their client on day one, they will gather more information.
Do you think that by gathering more information during the intake, that could be a less positive initial interaction though? That it could have an effect that they don't get as much accomplished maybe during their first meeting because they're spending a lot of time collecting data?
So their first interaction is, the main purpose of the first interaction is to understand you better, to know what's your need, rather than to just finish your need on day one. So the purpose of the first interaction is more get familiar with you and to let you know more about health leads and to get you comfortable with working with health leads. So I think since the purpose is not to solve a problem on day one, that should be okay.
When you look at the red person there, and you have three needs of housing, childcare, and job, is that no housing, no childcare, no job, so they need them, or is it a change in those conditions? And do those interact with each other? A person who doesn't have a job, they don't need childcare, except occasionally, is all of that, is the housing, is the person without housing, or without housing, without a job, and has children, and is in a shelter? How do all those things look like?
Yeah, so this one is just one example. I tried to simplify it. And in our data, actually, when the advocates first talk with the client, they talk with all these, do you need housing because you don't have housing now, or you need better housing, like what you said. So they write down text analysis, text documents, text narratives to document all these things. And we also categorize the need into more quantifiable categories of need. And we took all those need categories, and we also took the text as part of our model.
And do you have a reasonable expectations yourselves of solving those needs? Or helping them connect with somebody that solves those needs?
Could you repeat the question a little bit? I'm not sure how.
A person needs housing.
Yeah.
Does the person sitting at the desk know where to send them to find housing?
Yeah, so each of the advocates, they're trained by health leads. They know a lot of resources that they can refer the client to go to solve their needs. But this also depends on the advocate's experiences. Some of the advocates may be highly experienced, they will know the resource better. And some other advocates, they may be new, they will ask other advocates to help. And occasionally they also, there are very difficult cases is out of the scope of health leads. They will either refer this person to other organizations, or they give them some information and close the case. That also happens.
Thank you.
Have you been able to put the combination of the algorithm and remediation actions like in place with these guys at even a small scale with a few people and seen an improvement?
And that's what me and my partner Carl were trying to kind of persuade the health leads to do some pilot testing, maybe shortly after the summer. That's possible, but that haven't been implemented now.
Yeah, it'd be cool to see how it affects that 40%.
Can you clarify what you mean by commitment devices as a day 30 intervention?
Yeah, that's actually because we read a lot of literature on how you engage client in social service, and commitment device is a concept that's originated from behavioral economics. For example, like you give the client a piece of paper and ask the client to write down, I'm going to this organization to ask information about housing on Saturday. Like just by writing down that they made a commitment, they will go to do that thing. So if they don't write down anything, you just tell them go to do this, they maybe forgot or they don't, like mentally not that important for them. So using commitment device can maybe help return them to make them more committed to solve their problem.
So these are employee-facing commitment devices, not commitment on the part of their client or the user of the social service.
It's the advocates will ask the client because they refer resource to them to help them solve need. Like they tell them this organization have food. You should, if you need food, you should go there to get food.
I see.
So like they provide transportation, they have rental car. You should go there to get rental car. Like this can help you in your life, but sometimes they forgot or they have other things in their life that's more like busy. So the advocates can give them a piece of paper that they write down.
I understand. Thank you.
What's the data used to measure the quality of the initial interaction, the engagement, or the alliance built between the advocate and the family?
So currently we're using the narrative text in their first interaction.
The family's narrative of how that experience went for them?
No, the advocates write down.
The advocates?
Yeah, after
perception. Okay,
Yeah.
did the family receive
Yeah.
a survey or anything, or?
Not a large percentage. Yeah.
Can you please just clarify which sites where you conducted these analysis, which ones were they within the city?
Health Lead has desks across the country. They have desks in Boston, Chicago, San Francisco. Yeah. So we do these analysis on all the desks, but we put desk location as one of the factors. Yeah. I saw.
Perhaps more than a question, it's a comment. You guys are facing two huge challenges. One is working with a community-based organization. You know, we all claim that it will invest in more data, but community-based organization functions with very little resources, and there's very few of those resources to put into actual research. And the other part is that we're dealing with human beings.
Yeah.
And collecting data on human beings making decisions is always a big challenge, particularly when emotions are involved. We are completely incapable of capturing that as it is right now. So perhaps one of the ways of settling all of the questions that you have been receiving is by working with your partner to try to figure out what is it that they would like to measure. Because the outcome that you're focusing on, it seems to be measuring a lot of things. One of them can be successful for the organization, right? They find housing, jobs, and childcare, so they drop out because they don't need those services anymore. And that may be one variable. On the other hand, you can be measuring also client satisfaction, I think, what it right here research, by looking at how people are interacting with the organization. So maybe a definition of the objective of the study which that's the project that you're
Yeah, great comment. Yeah, actually, we're working with the partner quite closely, and for this particular project, they would like to focus on this connection. But I think for future project, like you said, satisfaction and like partial successfully met, like part of their needs are met. That's also good things. Yeah, I think those are also very good project in the future.
And just to add quickly to what he says, I think something that occurs to me when you talk about some of those indicators with needs is that at least within the city of Chicago, when it comes to something like food or childcare, that there are multiple different centers wherein you still have access to go to. So if you go to one center and you don't feel like it was a good experience, you can pursue your services at another center. And there may just be a disconnection and there would be a lot of explanation there. Whereas in other cities, there really is like kind of a one-stop shop. You don't have enough freedom of range to move within social service environments. So I don't know if there is a way that you measure that variable against the other. But I think that that's something that occurs to me when you have a range of options when it comes to pursuing social services.
Yeah. Any other?
Yeah, I was just a little surprised by the term commitment to devices rather than encouragement to devices. I think that the word choice is very important. What are your thoughts about that?
Yeah, that's a very good comment, because we kind of took this term from behavioral economics. We didn't. Yeah, I think we should think about better terms or to reframe it for social services. Yeah. Any other comments or questions?